right, so welcome to this presentation focused on IBD clinical research hosted by the Crohn's and Colitis Foundation. We're pleased to offer education and other helpful information to those living with IBD. My name is Brooke Razvani, and I'm a patient education intern at the foundation, and I'm currently a senior at New York University, majoring in public health as well as applied psychology. I'm super excited to be joined today by Dr. C.S.C., a gastroenterologist and researcher at the University of Pennsylvania. Dr. C is the anchoring author of a paper titled Patient Recruitment Strategies for Behavioral Clinical Trials in Adults with IBD, and I'll be asking her some questions about her research today. Dr. C, would you like to introduce yourself?
Sure. Thank you so much, Brooke, for inviting me. I'm excited to talk about this research study and to share our results with patients with inflammatory bowel diseases and their caregivers. So I'm a gastroenterologist specializes in treatment and research for patients with inflammatory bowel disease. I was trained at Yale University for medical school, then went to residency at the Mayo Clinic, and then Brown University for gastroenterology fellowship, followed by inflammatory bowel disease subspecialty fellowship at the University of California, San Diego. And I joined the University of Pennsylvania as faculty here 3 years ago.
Amazing. Well, we're so excited to have you here today. Before we get started, I'm just going to go over a few quick pieces of housekeeping. So the information provided during this presentation is meant for educational purposes only, and it should not replace any advice you receive from your gastroenterologist or primary care provider. If you have questions about your specific care, please reach out to your healthcare provider. The Crohn's and Colitis Foundation's IBD Help Center can offer support and information if you have any questions about Crohn's disease or ulcerative colitis by calling 888-MY-GUT-PAIN or emailing info@crohnscolitisfoundation.org. You can also access information about research and clinical trials on our website. So with that being said, let's get started. So my first question for you, Dr. C, is just to begin, could you give an overview of your background and how you got to where you are today?
Yeah, so I have a non-medical background. Nobody in my family or extended family is in medicine. However, during my studies throughout college, and I realized that I was really interested in the human body, helping people, and so and also, having financial stability. So this became a good, viable option, and I really like medicine. And each step in terms of kind of choosing specialty and subspecialty is really just testing it out, testing what I like, what I didn't like, what my skills and interests were in terms of am I more fitted for surgery or emergency medicine, or it turned out to be internal medicine that I like using my brain and my hands, and then also being able to work with different parts of the body, then hence internal medicine, and then subsequently specialize in gastroenterology because there were opportunities to work in a lot of different organs within the gastrointestinal tract.
Mhm.
Um, that includes anywhere from mouth to anus and pancreas and liver. And ultimately, I found the gut and inflammatory bowel disease to be most exciting. There's lots of exciting research and lots of both the science and arts of medicine that comes in involved with treating and managing patients with inflammatory bowel disease. There's guidelines, but then there's also things that are beyond guidelines because we don't know the right parts of what to do exactly yet. Research is still needed in those areas, and that's where the art of medicine is. So I really like that complexity of inflammatory bowel disease, and having also to work with psychologists and surgeons, radiologists as a complex disease.
Yeah, that's amazing. Thank you so much. So diving into your recent research, could you give kind of an overview of your research study involving randomized controlled trials?
Yeah, so the specific research study that is cited in this paper is called ADEPT. It stands for Addressing Disability Effectively with Psychosocial Telemedicine. So we're really looking at a randomized controlled trial where patients with severe, significant impacts of their daily lives due to inflammatory bowel disease. So we encapsulate that as inflammatory bowel disease related disability. If they have moderate to severe disability, we wanted to see if providing them with cognitive behavioral therapy over telemedicine could help relieve their disability and help them function better in life. So we recruited 90 patients for this part of the trial, but we overall surveyed 630 patients to assess their with inflammatory bowel disease, see if the degree of disability, how much inflammatory bowel disease affects their life, as well as other psychosocial measures like stress, self-efficacy. And then of those who qualify for the study, as in they have moderate to severe disability, we then randomize the 90 of them to see if the cognitive behavioral therapy will help patients or not. So patients either get cognitive behavioral therapy over telemedicine or they don't, and then we compare their disability levels after 8 weeks.
Okay, amazing. So that's definitely very important for the progression of IBD clinical trials. I'm kind of wondering how this study came about for you and your team. Like, was there anything specific that inspired it, or was it more of just kind of working to advance medicine?
Yeah, I think I noticed that, and as a also a physician, not just a researcher for a patient with inflammatory bowel disease, some patients there is this correlate between their amount of inflammation in their guts
Mm,
and how they live with their disease. So it
mm,
could go either way, as in, like, I could see a lot of inflammation in someone's body, or that they have had lots of surgeries before, they have had ostomy. So a lot of damage that's done by inflammatory bowel disease on their body, and yet they function really well in life. They're still working, they have family, they have kids, so despite the burden of disease, the physical burdens of the Crohn's disease or ulcerative colitis, some patients I notice, like, they thrive in life, they're living well.
mhm,
On the other hand, I also see the opposite, where I really don't see much inflammation in the gut on endoscopy or colonoscopy, but those patients still are not, like, they're on disability, or they're not working, or they're very um, like, there's anxiety and stress symptoms that are there, even though the inflammation's not active. So, and there's everywhere in between those spectrums. So, really, you see that there's discordance between the how much inflammation or damage or physical damage in the person's body and how they function in life in terms of their physical, psychosocial, and environmental, and in terms of relationship with people. So, I wanted to tease out and also offer adjunctive therapies for patients, because a lot of times, mainstay of inflammatory bowel disease treatment is anti-inflammatories, the
mhm,
medications that you inject or you infuse or you take, and that is really important. However, it seems to be more than that, that just treating the physical symptoms of inflammatory bowel disease or physical impacts is not enough to help people thrive in life. And so there's a with patients with chronic disease, and especially when that these are not curable and they do inflict physical, psychological impacts on patients, we find that the psychosocial aspects is one that can be neglected or hard to find solutions for. Um, so we want to study this telemedicine delivered cognitive behavioral therapy, where for 8 weeks, for 1 hour a week, they connect, kind of like what we're doing now on video and audio, with a therapist who will go through cognitive behavioral therapy with the patient. So walk through the disease. In other words, it's called talk therapy, to help
mhm,
identify thought processes or behaviors that may be unhelpful or hinder a person from living their life to the fullest, despite having inflammatory bowel diseases.
mhm. Okay, amazing. And then could you explain a little bit about the results of your study?
Yeah, the main results of the study are to be published, but we did find that um, this cognitive behavioral therapy was significantly and very, very impactful in helping patients with inflammatory bowel disease to live better. In fact, those who did cognitive behavioral therapy for 8 weeks, they were twice as likely, their function doubled that of patients who did
Mhm,
not undergo cognitive behavioral therapy. So that is to be published. We did publish this other paper already in terms of talking about recruitment of patients into this
mhm,
trial. Not the primary results are pending, but then
right.
a publication. But this study I would publish was like, how do we attract people, patients with inflammatory bowel disease, into this study? And we compare specifically electronic medical record recruitment as well as clinician face-to-face recruitment. So in
Mhm,
medical care, you can communicate with your physician face-to-face during clinic visits or electronically through the portal messages. And we
mhm,
compare those two in terms of inviting patients to the clinical trial to see what is more effective? Or is it something like a hybrid of both? If we had to do one or the other, what do people respond to electronic medical messages more or to face more? And what's more efficient? What's more costly? So that's what we studied. So in the study highlights is we did find that electronic medical recruitment was more efficient. Like we could message thousands, hundreds of patients all at once at the same time, kind of like email. You could email, 50 people at the same time. Whereas if you have to have a conversation, like patient clinician one-on-one, it'll be a lot slower. You have to talk to one-on-one per person versus broadcasting. Um, However, we did see that there's different rates of response. So sometimes people would say face-to-face conversations much more effective than something, I just get a message of. In our study, we find that overall, electronic when we send electronic medical record invitations, they were still more effective in terms of people clicking on our link and going to a study website than face-to-face physician recruitment, where we gave them a poster with a QR code to go to a study website. Electronic medical record messaging was still more effective, but not for all sites. Some sites, face-to-face discussion was
Mhm.
more effective.
Okay. So I know kind of that part of the study involves kind of recruitment in the trial. Did you personally face recruitment challenges in your study, or were you kind of experiencing it was easy to get participants?
Yeah, so I would say it was as expected. We weren't exactly sure how many patients would join, would be interested in a study, or would follow through. Ultimately, we found that we needed to reach out to more patients
Mm.
than we initially thought to reach enough patients who qualify or wanted to do the clinical trial with cognitive behavioral therapy. We also found that kind of each additional step a patient has to do in order
Mhm.
to do the study or finish study led to more people kind of falling through the cracks. For example, if we need people to complete a survey, to attend a telephone call, to sign an electronic consent form, for example, each
Mhm.
of these steps, we notice that of everyone who qualified for one step to the next, a, a bunch of them, like almost half of them, don't make it to the next step. So, kind of the more steps or barriers that we have in place for patients to reach, point A to point B, then fewer get there.
Okay, perfect. So that actually leads right into my next question, which is why do you believe that recruitment rates are so low in IBD randomized controlled trials? And do you see that in attrition rates as well or not?
Yeah, so I think a lot of it comes down many different reasons. So there's personal reasons, there is like in terms of individual patient reasons, and then also the clinician reasons, and then institution, and then just the study design overall. So at the patient level, sometimes patients are interested or not interested, they understand or not understand the study, or it's something they have time for or don't have time for. Travel isn't an issue in ours because it's all electronic and telemedicine, but for
Mhm.
other studies that require lab draws or clinic visits to measure their blood pressure, heart rate, for example, that could be a logistical issue too. So it could be concerns at the barriers at the person patient level. And then in terms of clinician level too, it's, how do patients know about studies, right? They could go on websites or they need kind of know from their medical team, their doctors, if their physicians or medical team aren't interested in research or already really stretched really thin with providing patient care and don't have time to talk about research or to discuss with patients, that's also a barrier that patients won't get to know about it. And then in terms of the kind of more external factors, it will be the project level, what's required from the study, as well as um, any reimbursements or any enumeration for a patient or how burdensome it is. I think for the patient or the physician can be barriers for joining uh, clinical trials. And then kind of for a lot of these things, I think for patients to participate in clinical trials, there is an aspect of like kind of altruism. Like you get a little something from it, you learn from it, you may learn something about yourself, but it's really contributing not directly to your medical care or your future, but
Mhm.
helping study something that is unknown. So it does take, a very special kind of person, and we're very grateful for it. But that's because we do have people who participate in clinical trials who are willing to try and test things that we have, the advancement that we have today, and trying to make all the all the lives of patients with inflammatory bowel disease better.
Amazing. And then in your experience, do the patients who were recruited successfully for your study in any site share any particular characteristics, and why or why not do you think that is?
Yeah, I particularly for this study, we didn't analyze that in terms of who gets recruited versus who doesn't get recruited, because that's a trickier part. Is we know who gets recruited because they answer survey and questions, so we know their gender, their age, their inflammatory bowel disease status, for example. But we don't have that information compared to those who didn't come join the study because they never answered any of those questions. So for this study, we didn't specifically study characteristics of those who joined the study versus not joined the study.
Okay, totally. So kind of going off of that, we know that certain groups or populations may be underrepresented in clinical trials. Could you talk a little bit about this in your experience and about the diversity in your study?
Yeah, so we have patients. Generally, I think depending on the study or how it's administered, we see differences in participation by race, but also by age group, the work status. Are they
Mhm.
retired or are they in the working age? We do sometimes see younger patients participate more, maybe because uh, of the electronic nature of certain studies that you need to do online surveys and go to certain websites. Technological savviness or digital literacy can come into play in terms of who participates in this clinical trials and who does not.
Okay, perfect. And based on my understanding, it seems as though since all of the sites involved plan to continue using EMR messaging as their primary kind of recruitment tool, the study was obviously very well received by the sites. So I'm wondering, do you think that there's a specific reason for that preference outside of like the noted burden that clinician-led recruitment placed on medical staff?
Yeah, I think really all the sites plan to use electronic medical record messaging for future clinical trials. And they could certainly still talk to patients about the study using paper and poster because they did see that it was more effective. It needed a lot less time to send, 1,000 patient messages at once than talk to 1,000 patient one by
Mhm.
one. The efficiency and that it was ultimately effective. So patients get a message and they can click on a link. And we did see that there's anywhere from 7 to 17%, so 1 in 10 or 1 in 5 patients who would respond to the messages, that it didn't fall on deaf ears,
Mm.
that it was effective, that all the sites, for its like low cost, it doesn't cost anything for us to send a electronic medical record message, very little time, um, and also that it's effective, so that I plan to use this method. Maybe in addition to face-to-face messaging, but certainly it's found to be a very good method for recruiting for certain studies, and for us at least getting the word out there. It's almost like just outside of clinical studies, you have social media, you have
Mhm.
different types of things that you can click on the phone, and that's a lot of people use their devices to get information and messages and apps and quick little bites.
Of course. Okay, so I have one more question. So, what are the next steps in the research, in your opinion? Where do you see it going? How do you see it kind of transforming clinical trials in the future?
Yeah, so I think really we want to, um, one of my goals in not just this study, but I have other research studies to run
Mhm.
pragmatic research trials, as in not just run research trials in very tightly controlled settings that maybe certain only very limited amount of people can actually do clinical trials. That so to try to ease that burden to run clinical trials in a real life setting for patients, so that to ease the burden of um, trying to not having to go in person visits or do very, very, very long surveys, so or gather data that we don't need. So really trying to be parsimonious about it, as well as to involve patients in the design of the clinical trial. So for the clinical trials I'm running, we have a plan, we have research plan, scientific plan, but then we also involve patients in the study team, that so that we ask, does this all make sense? Or is it like, it doesn't make sense, we don't want to do this? For example, another study we're doing is an intervention with a book, and then the
Mhm.
book can come in, hard copy and ebook, and we're trying to say, should we do one or the other? And then it ends up being like, maybe certain people, like older people, will want to read a book, and then younger folks want the ebook, so let's include both. So we want to incorporate the patient's voice and opinion in the research study design as well. So I think this is depending on the type of research study, but this is where we're going, where we want to design research study as more pragmatic to do, and that so the result is more generalizable to people everyday life and real life, as well as to incorporate patients into research studies, their voice and perspectives, not just a scientific person or the medical person, but those who ultimately impacts, to see certain things, does it make sense, does it not, and to change the research design so that it's less burdensome for patients, and that um, we get information that's useful for them.
Yeah, for sure. Definitely patient-centric design seems to be very important and beneficial to even the researchers as well. But that's all I have for you today. So thank you, Dr. C, for discussing your research with us. I do want to reiterate just to anyone watching, if you have any questions about IBD and participating in research, including any clinical trials, please visit the Foundation's website at crohnscolitisfoundation.org and the clinical trials community webpage. You can also contact the Foundation's IBD Help Center by calling 1-888-MY-GUT-PAIN or emailing info@crohnscolitisfoundation.org. But as always, we recommend you discuss any clinical trial of interest with your healthcare provider. Other than that, thank you for tuning in.